What's up, YouTube? It's Siobhan Renee. I guess you could say this is my first official video regarding my TTC journey and the fertility issues that we are having while we're trying to conceive. So I'll give you a brief little history. I've been married for 5 years. My husband and I have been trying to conceive a child for about 3.5, 4 years. But it wasn't until this year, that we have really okay, let's buckle down. Let's really see, why we are not pregnant. So April 1st, I had, no, actually it was before April 1st. So I'll have to say sometime in March or whatever. I wanted to go see my regular doctor because I had bleeding in between my cycles, which was not normal for me. I couldn't understand what was going on. I'm like, I don't know what's this going about, whatever. I have, short lengths in between my cycles anyway. So I could not figure out. I figure, let me go to the doctors. Let me go see what this is all about. So I told her my symptoms and all of the different signs and stuff that I was having. And so she recommended that I get 2 ultrasounds. One was just a regular ultrasound, where they go over your pelvic area or whatever. And I also had a transvaginal ultrasound where okay, this is just a little example, but it is not, the wand that they use is not this big. It's not this big. It's maybe about half the size of this and maybe about that much in length or whatever, where they insert it vaginally and they check out your ovaries and all of this stuff, and just to see what's going on or whatever. So I got my results back from that not a few days later, but it was actually a week and a half later or whatever. So got those results back. They called me, said that I have not a mass, but they saw something on my left ovary, which it did turn out to be a cyst. So I got referred to a local GYN. So I went to go see him April the 1st. So I have my first appointment with my doctor. His name is Dr. Jones. I absolutely love Dr. Jones. He is seriously one of the most comfortable doctors that you can ever have. A lot of women may have an issue with having a male doctor. I really don't have no issue with men doctors because you have seen everything I have. Okay, you went to school for this, my anatomy, whatever. So I was very comfortable. Anywho, I had to get another ultrasound. So I had another transvaginal ultrasound, I guess just to see what was up with the cyst or whatever. So those results came back that I think it was not a 7-inch cyst. I don't know. It was 7 something. I don't think it was 7 millimeters or centimeters. I don't know what it was. Anyway, I had a cyst on he did see the cyst on my left ovary, but he also saw something on my right ovary also. So he prescribed me metformin, to see, if that will help shrink down the sides of the cyst or whatever. So I was on metformin for about 2.5, 3 weeks or whatever, which let me tell y'all, when you first start taking metformin, it is a lot that your body has to go through just to be able to get used to taking the medicine. Y'all, bubble guts ain't the word for what you get when you on this medication. I only started out with 500 milligrams once a day. But then, he eventually moved me up to 500 milligrams twice a day. So I was taking, 1,000 milligrams. Y'all, those first 48 hours, I was literally back and forth to the bathroom. My stomach was so upset. It was so upset. I could not hardly eat. But y'all know, listen, the plus side to not being able to eat was I slimmed up a little bit. So I was happy. But those symptoms went away over time. So I was okay, whatever. Anyway, when I went back for my follow-up appointment, just to see where things were, I had another ultrasound. So, the cysts were still there. Not the left one, but the right one had increased in size or whatever. So he did recommend that I go have a laparoscopic surgery, which I did on May the 1st. So he did the surgery and he did remove a cyst from the right ovary and a polyp that was forming. So nothing was wrong with the left ovary, the cyst or whatever. He also did another test. It wasn't necessarily an HSG test that he did where they insert the dye into your fallopian tubes to see if, there's blockage or anything. He didn't do that one, but he did, I think it was like insert like a little saline in there, but everything was clear. Like my tubes were open or everything, and he gave me, the all go ahead to be able to try to conceive, a week later, which I think I timed that perfectly because I'm like, okay, I'm going to be ovulating soon. So if my tubes are clear and I do not have this cyst on my right ovary, maybe I can go ahead and get pregnant or whatever. So we tried or whatever for that baby. A week after my surgery, it was laparoscopic. So I was pretty much like healed up or whatever, like within like 3-4 days or whatever. The only problem I had was I was a little sore. But anyway, that did not stop me. I did not get pregnant that cycle. That was for the May cycle. I did not get pregnant the June cycle, the July cycle. By then, I'm thinking, what in the hell is going on with my body or whatever? So went back to the doctors. I did have an appointment with the fertility specialist, but, life happens and I had to cancel that appointment. And they were supposed to call me back so I can reschedule the appointment, which they didn't. So whatever. Whatever. Anywho, I'm not gonna, act like somebody killed my goldfish and have a piss party for myself all day. I'm not gonna go over that. Anywho, I figure, okay, you know what? I'm gonna wait till the end of the summer, to see if we can still try to conceive naturally, which it is October. I ain't pregnant. Okay, I'm not pregnant yet, and this is starting to take a stressful toll on me. Like, seriously, it is all that I obsess over. I think I'm gonna have to do a video like later on with my rants with the whole TTC journey or whatever, because it's stressful. And you're not supposed to stress when you're trying to conceive a baby because, it can have negative consequences or whatever. But anyway, fast forward to now, I was still taking my metformin up until last month when my prescription ran out. So I called to get my prescription filled or whatever. I had to, call the doctor's office and all this stuff. So he wants me to come in and have, like an appointment to see exactly what's going on. So I do have my appointment. I'm going to make my appointment for a couple weeks from now. So just in case, something comes up or whatever, which I have been having a lot of ovarian pain in my left ovary. So that cyst over there been acting a fool. It acts a fool. Like, I have ovarian pain before my cycle, after my cycle, and of course during my cycle before I ovulate. Like, seriously, I have ovarian pain like in a 4-week month, about 3 weeks out of that 4 weeks. But those few days before my cycle comes on and the few days before I ovulate, when I say I get crippling, intense pains in my pelvic area. I mean, it'd be so bad, like it's hard to walk sometimes. So I definitely want to go back and see if more cysts have grown, since my last appointment a couple months ago or whatever. And if those cysts have grown, I want to get another laparoscopic surgery so I can get them removed. I will also want to get the HSG, where they, insert the dye into not your ovaries, your fallopian tubes, to make sure that your tubes are actually open. And if they have a little blockage, that dye will pretty much blow everything going out the water. So I'm trying to get all of that stuff done before the end of the year, because the holiday season is coming. It is my favorite time of the year. I'm not trying to be laid up in no bed looking crazy trying to recover from surgery. Although when you have it laparoscopic, the surgery is your recovery process is only like a week or whatever. So I'm trying to enjoy my Thanksgiving holiday and my Christmas holiday, hopefully pregnant. So I'm trying to get that done like within the next 2.5, 3 weeks or whatever. So, it's a journey. It is a process. It is a stressful process. So I guess I just wanted to make this quick video real quick just to tell you, I guess this video was pretty much just about my cyst, my ovarian cyst. So hopefully I will have a more in-depth update, within the next 2 weeks after I go see the doctor and all of this stuff. So y'all pray for it, girl. Pray for my sanity. Pray for my husband. Pray that he can put up with me and my crazy obsession to become a mommy. So I'm in my 30s. I'm approaching my middle 30s. And we all know once you get over a certain point in your 30s, like, your chances of conceiving, they really start to go down. And, I'm trying to have a baby way before I turn 40. Okay, so anywho, that is just my little, I guess, my TTC mini rant. So, and my rant about my ovarian cyst. So if y'all know anything about ovarian cyst or have had them, or anybody that's going through the same process, leave me information about it. Suggest things to me. Shoot me an inbox. It does not matter. Comment on this video. It does not matter. I need all the information that I can possibly get and encouragement. So I guess until next time, this is my mini rant. My mini rant video. So hopefully, the next video I will definitely have more information on my process or whatever. So pray for me. That's just it for right now. So I'll talk to y'all later. So we all in this together. So see y'all in the next video.